Hello and good evening, everyone. We're just going to wait for a minute or two for more people to join in, and then we'll start with today's live. Okay. Uh, Welcome to the second episode of the Frontliners, an interactive live series where prominent people leading the management of COVID 19 share factual and relevant information about the pandemic. In this episode, we're going to talk about the role of medical centers in COVID 19 management. Over the past 5 months, the medical centers have been fighting against the virus, managing the symptoms, assessing the risk factors, and deciding the line of treatment. It is humbling to think that there are so many stories of patient recoveries that we are incredibly grateful to every single doctor working round the clock, pushing themselves to the limit and putting their lives on the line, often with limited resources. And we have one such personality with us today. Today's guest speaker is Dr. Rashida Melinkeri. She's been putting in all the efforts to make sure successful recovery of every single patient under her care. Dr. Rashida is a consultant physician, a lipidologist, and specializes in internal medicine. She has been working tirelessly for the last 5 months to provide best possible care to COVID patients at AEM and Sayadri Hospital in Pune. She has played a vital role in streamlining the medical management process at these medical centers. So let us all welcome Dr. Rashida to today's episode. Hello, good evening. Thank you so much for joining us today, Dr. Rashida.
Hi, Saurabh. Good evening. Good evening to everyone. So, hi.
So,
Yeah. Sorry,
yeah,
Go on.
so let's start with our today's episode. Today we're going to talk about role of medical centers in COVID-19 management. And before we get into that conversation, I would like to ask you, okay, how did you get involved in the management of COVID cases a few months ago?
Okay, so now there is a long story behind this. My actual interest is in metabolic medicine. I deal with lipids as a subject. It's my specialty or it's my subject of interest. But it so happened when when COVID hit our country, there were not too many doctors who were willing to look after patients. Most of the doctors were untrained. The hospitals did not have set protocols. There were a lot of things which were amiss. And
Right.
it started with this one single patient of mine who has been under my treatment for the last 10 years. She walked into my OPD and said she's been feeling unwell with a little cough and fever. Now, remember, this was my first patient, but something there made me feel, probably I'm dealing with a patient who might be suffering from COVID. I got her X-ray done, checked her oxygen status, etc. I was now sure that this was COVID, so I got her admitted at one of the hospitals which I'm associated with. Now, these were the days
Your voice is cracking. We're
when
losing you a bit, maybe because of a network.
the hospitals such an unstable internet connection. Sort of. Okay, can you hear
Yeah,
me
yeah, it
now?
is. Yeah, yes, it is better.
There was
Go
this
on.
thing. So,
Yeah.
a 150, sorry, a 550 bedded hospital right in the heart of the city of Pune. It had barely 10 to 15 beds to offer to the patients. Anyhow, I admitted this patient of mine, and she was under my care for nearly 15 days. She became well, completely recovered. She went back home. But now, those 15 days, we have to understand it was really difficult, not only for me, even for the patient to cope up. I remember each single day going for my rounds, dressed up in a PPE. I used to ask her how is she, and I had to actually go there and introduce myself to her. Hey, hi, this is your doctor. I'm Dr. Melin Piri, and she used to be delighted because I was the only one whom she could connect to. Most of the other doctors, staff, the class 4 workers, etc., who were entering and exiting were all dressed in PPE kits, and she could not recognize anyone. Also, at the same time, she and her family members of 11 to 14 of them, no, there were 11 of them, all of them were diagnosed they were all positive. They were all hospitalized at various other centers across the city of Pune, predominantly in the government centers. And one of them happened to be a 1.5 to 2 year old child. He was the only one who was negative, but because there was no one to look after the baby, he had to accompany his parents and get hospitalized. This lady did well, survived, went home. She's doing really well. She had none of the sequelae after recovery also. Unfortunately, her husband succumbed in a different center, but he was old. He was nearly 75 plus. He had diabetes. He had underlying cardiac conditions. It was sad. And even when, I mean, although the husband expired, even before the patient was discharged from the hospital, I did not have the heart to give this news to her because she had nobody else around her for moral support. So just a day before her discharge is when I told her, you know what, your husband's not well. He's really critical and he may not be able to survive. And I left it to the son to declare once he meets his mom that she has, you know, like that father has succumbed. Another thing was like I used to be the point of contact between the mother and the son. Each day morning at 8:30, it was her son who used to call me up saying, "Madam, how is my mother doing?" And when I went for rounds, the mother asked me how were all her relatives doing. Now, another important thing which came up later on was she was to be discharged 3 days earlier than her son, but because she had nobody to look after the discharge process or even take her home, I had to keep her back, waiting back for another 3 to 4 days till her son was discharged. He came and collected her. Anyhow, so this is how I managed my first patient. One led to another. He brought in other patients to me. Certain general practitioners started referring. The hospital realized, yes, this doctor is interested and taking a keen interest. They started sending patients, friends, relatives. That set the ball rolling. And now, for the last 3 to 4 months, I've seen a number of patients. Most of them have survived, done well, and they have gone home. Of course, there have been a few deaths, but definitely better than what it was. Much better.
Right, right. First of all, thank you so much for the whole service that you doctors are doing at medical centers. It's really risky even for you to go there and treat patients. Coming to the medical centers, everybody is learning on the job. This whole pandemic situation is new for everyone. So, medical center must have also gone through some changes. So, what has been the change in medical care facilities since the onset of the epidemic till now?
So they are much better than what it was 5 months back. When COVID hit our country, we were all completely unprepared for it. But now the systems are better. Most of the hospitals are divided into COVID and non COVID areas, and they would have separate entries and exits. So there is no mixing of the two separate populations of patients. Besides that, we have a concept of before going on to holding areas. So when a patient walks in, if he has fever, cough, or any symptoms to suggest a flu-like illness, they generally end up going to the flu clinics or to the triage clinics. We have doctors sitting there who do various tests, including X-ray and various other things, and then decide about the further line of management. Patients who come in and may need hospitalization, who sure shot fit into, I mean, history on examination, we feel they would be suffering from COVID illness, are straight away admitted into the COVID areas. Most of the other people are held back in what we call as the holding areas, where a swab is sent, certain other tests are done, till we are sure whether if the patient is COVID or non-COVID. If he's COVID, he goes on to the COVID areas, whereas if he's non-COVID, he goes on to the regular areas. This is important because this is going to be the deciding factor. We would not want somebody who is COVID negative to end up in a COVID positive area. Secondly, the diagnostics have improved at the hospitals. The swabs, which the cost of the swabs have come down by nearly 50%. And I actually heard there might be further reduction in the prices. What used to cost nearly 4,500 3 months back is now costing around 2,000 to 2,200 at most centers. The turnaround time of these swabs is quick. Within 8 to 10 hours, at times, we are able to get results, especially at the hospitals, because then that is the deciding factor for the patients admitted in the holding areas. Third is HRCT. The CT scans are being done of more patients who even are swab negative. The radiologists are better trained to identify, small changes in the lungs which an X-ray might miss, and then again they are segregated as COVID and non-COVID. Another important thing probably would be the staff. The staff and the doctors are much more trained, much more experienced. We have PPE kits of better quality which are available, so the chances of transmission get reduced. Medications, availability of medications, the cost of medications used to be a huge issue. It is better, much better than what it was. I remember there used to be a waiting time of sometimes 3 to 4 days for the medicines to arrive. There used to be badges of probably 70 to 80 vials entering the city of Pune every third day. And imagine this has to go to the various hospitals. It was like a nightmare, knowing the diagnosis, but we could not lay our hand on the various medications. So, yes, definitely the hospitals, the COVID care centers are much more prepared and doing better than what it was 4 5 months back.
And we are very glad to know that our whole medical system pulled up their sleeves and started working towards it and has pretty much streamlined the whole process. Now, coming to a very important question, which all of us have in their mind, and we have had or heard very contradictory statements about this. So, what are your views on mask or no mask?
Okay. Mask, I think undoubtedly the answer to this is yes. A mask is a must for two reasons. One is it prevents the transmission of virus, and it also prevents the acquisition of virus. How? Let's say we are talking about two people, person A and person B. Person A may be an asymptomatic carrier of the virus. However, if he is wearing a mask while he is, of course, most people are distanced nowadays, but even with that distancing, if he is wearing a virus, he will not end up transmitting that virus to the person he's speaking to or in the environment. Person B, let's say a few virus particles do escape, but since person B is wearing a mask, it helps him to prevent, I mean, he does not acquire the virus. So it helps in both the transmission as well as the acquisition of the virus. So mask is a complete must. No second thought about it. It's a
All right, thank you.
single most effective measure which has been found to be most effective as compared to anything else put together.
Right. And thank you so much for clearing that. Just like when you say mask, any mask is fine, or is there a particular mask that people should be wearing?
Okay, so there are again a whole lot of varieties and so many things which go on regarding mask. But for the general population, a triple layered cloth mask is good enough. This needs to be washed every day. That generally prevents. It has been found to be very effective in preventing the transmission and the acquisition. However, for healthcare workers, since they are under high risk, the doctors, the staff, the nurses who enter, especially the ICU or the COVID areas, N95 mask is advocated. You would even find doctors, who are doing non-COVID work, sitting in their OPDs, they just end up using surgical mask, which is equivalent to a triple layered cloth mask.
Okay,
So
all right,
not
understood.
necessarily N95 should be used by everyone. In fact, we should probably leave it aside for people who are at higher risk.
True, true. Uh, my next question is about the screening measures that are being taken at various institutions, at businesses. Screening measures such as temperature check, oxygen saturation, and heart rates. So, these things are monitored. How effective are these screening measures?
They are very effective. They are definitely good screening techniques. Even in a hospital, I mean, when I enter the hospital every day, they check my saturation and temperature. It is done for even the healthcare workers as well as the general people, who enter. If you were to pick up somebody who has been running fever and you ask him, he has got other symptoms, he might be harboring COVID virus. Saturation is an even more important guide, because the minute you see somebody with a low saturation, it immediately alerts your mind you may be dealing with somebody who is harboring COVID virus, because there is a concept known as happy hypoxia. You would see people walking, talking, they're very comfortable. Sometimes they're asymptomatic, but they can have they can have low saturations. So
Right.
that again helps. Then in
Just
sorry, malls, other areas where they tend to be crowding and all. Again, a good screening feature. So
Yeah.
good screening.
Just for the understanding of our audience, can you explain what are the normal values for these temperature check and oxygen saturation?
All right. So for temperatures, any temperature up to 98.7 or even up to touching 99 is good enough. Anything beyond that is generally taken as fever. But then it's not just one single isolated value. You have to have a serial of values. As far as the saturations are concerned, normal body saturations are 97% and beyond. It would depend, of course, upon, if you're obese, the lungs cannot expand comfortably, and you may have saturation up to 97%, which is normal for your body. And you may have people who have saturations up to 100%. In people in COVID illnesses, generally the saturations can be normal initially, but they drop. So any saturation which is below 95, so 94 and below, all suggest COVID illness. May suggest COVID illness. Let's put it that way. And they're
Very
also
true.
used
Understood.
for, yeah, they're also used for differentiating, your mild, moderate, and severe cases. I'll speak about it a little later.
Okay, for sure. So now my next question is, who are more likely to contract the infection, and what precautions can be taken to reduce that risk?
So now there are three important groups of people who are at high risk of contracting the infection. The first would be people who are under high oxidative stress. That is, people who have some amount of inflammation going in their body, which is generally found in people who have heart diseases, hypertension, diabetes, and the most important risk factor is obesity. We have found people who are obese, uh, the they generally run a more severe course of the illness. Mortality rates are higher, or they end up being on the ventilators for a longer time. So this
Right.
is one group. A second group would be people who have compromised immunity. So elderly people 60 plus, but even people probably 50 plus. We have seen a lot of people who are 50 plus and who are easily susceptible to the virus. Is with compromised immunity. People who have various malignancies, either hematological or solid organ malignancies. People who have undergone chemotherapies, radiotherapies, again at a higher risk for the infection. And the third would be professions. So again, healthcare workers, including our security guards, the class 4 workers, our nurses, lab technicians are at excessive risk because they deal with the swabs of the patient, for the diagnostics. And of course, our junior doctors, consultants, intensivists are at high risk. So these are the three categories who are at high risk. Now, the second part of your question is what precautions can be taken to reduce this risk? So this is again very simple and ordinary things would be the first thing. So using the mask is a must. Second is distancing, social physical distancing. So generally maintaining one arm distance between yourself and the next person is what is needed, and washing your hands, sanitization. So washing with soap and water is the best thing to do. Of course, if you are in areas or under circumstances where soap and water is not accessible, you can use sanitizers. One, maintaining distance is important. Even in ICUs and hospitals, let me tell you, when we are doing our rounds, we stand at a distance from the patient. Our junior doctors, our nurses, and all stand at a distance from us. And this is not a part of the question, but this makes treating these people even a bigger challenge because we are at a distance from there. We are all in our PPE kits. We are wearing our masks, two-layered gloves, two layers of cap, and the PPE kit. And it's very difficult, or actually, it's impossible for us to examine the patient. We can't even use our stethoscopes, no, not accessible to the ears. And we generally treat the patient based only on three important parameters: the heart rate, the temperature, and the saturations of the patient. That's it. And by asking them certain questions. So these are the precautions that should be taken. Early diagnosis. Do not skip or do not ignore mild symptoms. Even a little fever, ongoing fever for 2 3 days, feeling unwell, etc. So early diagnosis would be equally important because once you are diagnosed in time, you can start your treatment and you can get isolation or quarantine.
True.
That's
Uh,
very good.
j- just because we're on the topic of who are more likely or who are at a high risk, what are your thoughts on infants and children below the age of 10? Because there are some contradictory statements about that as well, and parents are really paranoid right now who have infants or young kids at home. So, is there any statistics on that, or is there any clarity on that?
So, this is again conflicting data which is available. But let me point out two things. So, I was just looking up, and there's some data which has been released by UNICEF, and they say that children are at much lower chances of, the prevalence and the incidence is much lower in children, especially the age group, age group up to 10 years of age, 10, 12 years of age, the infants and all. And I remember two families. So my first patient, I told you, who was hospitalized, I remember I told you a 2-year-old baby who was swab negative. And on another two incidences, I've had a family of probably 10 of them where the child was 4 years old and was negative, and another instance where I had another, I think, 8 patients positive, except the 8-year-old child. So
Right.
probably the incidence is low, is what I feel, but then probably a pediatrician may be able to give a better answer. They might be
Understood.
dealing with more of it. And
True.
adolescent, just to add one more point, adolescent kids, that is, 13, 14 years onwards, they have they are at the same, same incidence like others. Chances are similar of them to acquire the infection like the adults.
Okay. All right. Thank you for clearing that. Now, another thing that I wanted to ask you is about the symptoms of COVID-19, because there are so many symptoms. Every day you see the symptoms are changing. And so, what are the actual symptoms of COVID-19 that people should look out for?
Okay. So symptoms. Symptoms are very similar to a common cold or to a flu-like illness. Sore throat, discomfort in the throat, mild cough, running some amount of fever, feeling unwell, some amount of fatigue, body aches, tiredness. This is what people would present with. Uh, 2, 3 points which we need to remember. So one is lack of sense of taste and smell is a strong indicator that the patient may be harboring the COVID virus. High grade fever is generally not a feature of COVID illnesses. So, they would have temperatures up to 100 or so. But your really high fevers like 103, 104 is rarely seen, is not that common. Sneezing, running nose generally again are do not favor a diagnosis of COVID illness. They're not commonly seen in COVID illnesses. You have certain rare symptoms like patient can come with abdominal discomforts. We've had patients presenting with loose motions, and they turned out to be COVID positive. So this would be in the initial phases. But as I said, a lot of us actually ignore the symptoms in the initial phase, and by following the post seventh day or so is when the complications start setting in. So those days, that at that point in time, people present actually with symptoms pertaining to the complications. If they have lung involvement, they might have shortness of breath because they have
Hmm.
underlying pneumonias. Patients can present. There's an increased tendency of formation of blood clots in people with COVID illness, more so from the seventh day onwards. So people come present with heart attacks and strokes. Just 7 days back, I had a patient walk in the emergency department of one of the hospitals. She was a suspected COVID illness. A doctor outside had advised her to get hospitalized, which she refused. And she had severe chest pain for nearly 48 hours associated with uh, vomiting, sweating, which basically pointed to a cardiac or a heart related issue. On doing her ECG, she was found to have a significant, there was a heart attack on one of the walls of her heart. We subjected her within 24 hours, I think, and we were unable to dissolve the clot because she had a vomiting of blood. So then it's not possible for me to give her blood thinners. So we had to rush her for a primary angioplasty. She's doing well. She'll be discharged tomorrow. And then I remember this other another lady. She was a 50-year-old lady, asymptomatic at the time of admission, and nearly asymptomatic, except some little fever and all. But within 5 to 6 days, she developed weakness of her left arm. Basically, she had a stroke which set in. There was a blood clot in a part of her brain, but she's also doing well. She was discharged since she was in the hospital, so we could, diagnose early and treat her early.
Right. And you repeatedly you have mentioned that early diagnosis is important. But for that, how to differentiate between a mild and a severe symptom, and how to understand the need of going to a hospital? How can people identify that and differentiate between mild and severe symptoms?
Okay. So actually, there are four categories based on the severity of symptoms: asymptomatic, mild, moderate, and severe. Now, by asymptomatic, there are actually people who have no symptoms. So, let's say somebody has come in contact with someone and he does a swab, but he's got no symptoms. That is asymptomatic. Or, sometimes randomly people just go and check their swabs and all because they're worried since after following travel and all, they are negative. So, they might turn out to be positive. So, these are the asymptomatic cases. They truly have no symptoms. So, this is the group which can undergo what is known as home quarantine. Second group is the mild cases. These people would present with symptoms like flu-like illness or a common cold, little bit of fever, a little bit of sore throat, a little bit of cough. These are the mild cases. These patients have the option of what we call as going to the COVID care centers, where they can be treated on OPD basis, and if needed, certain tests are carried out on them, and if needed, they can either undergo home quarantine or they can undergo isolation in the COVID care centers. Now, their COVID care centers are actually makeshift arrangements. I'm sure most of you would have heard a lot of hostels, hotels, playgrounds, etc., have been converted into COVID care centers. So that is
Right.
mild. Third is the moderate category, where the patient would generally have some amount of lung involvement and they come with shortness of breath. This group will generally need hospitalization. And last is the severe cases who come with multi organ involvement. They will have fever, they're extremely breathless, their saturations are very low. They might be having kidney failures, lung problems, heart issues. These are the severe cases. Another way to differentiate, for just for general information, asymptomatic cases would generally maintain their oxygen saturations normal. Mild cases would have saturations up to 95 and beyond. Moderate groups would have saturations of 90 to 94, and severe category would have saturations less than 90. But what is important for us to understand, it is not safe for us to decide, or for any patient to decide for himself as to which category he belongs to, and try to either self diagnose or self manage or try and manage over phones. It has to be under the guidance of a doctor or a COVID care center, because people turn a case who is mild today can end up becoming a severe case tomorrow, a severe or moderate category tomorrow. I'll point out two examples in this. A friend of mine, who is a doctor by himself by profession, runs a hospital slightly away from Pune. His father-in-law was tested positive, and I remember him calling me up maybe 2 weeks back saying, "Ke, Rashida, my father-in-law has tested positive, but he has absolutely no symptoms. So what should I do?" Now, uncle is around 70 years old. He is obese, and he's undergone underlying cardiac issues. He's undergone angioplasty in the past. I told him we need to hospitalize him at the earliest. We put him in the hospital. Of course, because the worry and the fear of the illness is so high, uncle did get admitted, but he was really unhappy about it. He was like, when I went and met him the next day, he said, "Why have you put him? Let me go back home." But within next 24 hours, when I went for my rounds the next day, I found he had moved. He had jumped from mild to nearly severe category, and I had to rush him to the ICU. He went on a ventilator for nearly 5 to 6 days, but he's settling off now. Another case is of this mother and son, both of whom were asymptomatic. No, they were mild cases when they got hospitalized. The son did well, went home within a duration of 8 to 10 days. However, the mother, although she did well for the first 72 hours, following which we started noticing that her oxygen saturations had started dropping. She needed to go to the ICU. She went on a ventilator. She even had a small paralytic attack, and a whole lot of issues followed. Eventually, she did well. She's recovered well, and she continues to have some amount of weakness of one of her arms, but she's completely independent otherwise, and she went home. That's why the importance of not trying to segregate ourselves into categories. We need to be with under the guidance of a doctor or a COVID, a dedicated COVID center.
Right. So if I understand correctly, and to for all our viewers, basically, in case you're showing symptoms and you think that you might have contracted the virus, it's a best idea would be getting yourself tested and letting your doctor take a call if you need home quarantine or otherwise. So we have a lot more questions for you to understanding what process happens in the medical center, and for that section, for our second section in the conversation, I would like to welcome Rupal Sancheti, director of HealYos, to the conversation. Welcome, Rupal. Good evening. Thank you for
Hi.
joining us.
Hi.
Hello. Hi, Rashida. Thanks, Saurabh. I'll take a few more questions, Rashida, from here. It's been extremely interesting, and you've been giving us a whole lot of examples. But generally, taking off from the examples that you gave us, what is the current process after somebody tests COVID positive? Like, what do we do? Now, people are really not only the doctors telling them, but people are going and getting tests on their own. So, what is the current process followed?
So once somebody tests positive, they need to get in touch with a doctor or with a COVID care center. So if they are asymptomatic, they can undergo what is known as home quarantine. So they can be quarantined at home after a series of tests. The rest of them, like mild, moderate, and severe category positive ones, they will need either isolation at a COVID care center or at the dedicated COVID care hospitals. But when you are positive, don't stay quiet about it. You have to get in touch with somebody. You have to get in touch with a doctor or a dedicated center,
That's
especially
very
patients
true.
at high risk. Especially people at high risk. You can have a lot of people who are asymptomatic, but they are at high risk, and this is the group who generally lands into problems. So they need to get in touch with somebody, and if needed, they need to be hospitalized. Now, I'll give you an example. I somehow have a lot of examples. I don't know how come, but they just keep coming to
That's
me.
the experience you gathered over so many months.
So just the other day I was driving and a friend called me up and he said a friend who is caught in US, his parents live by themselves in US.
I think your internet froze for a minute. Bear with us for a few minutes. Saurabh, are you able to hear her?
No,
Saurabh?
even I'm not able to. No, I'm not able to hear. There
Okay,
might be
we'll just
some
wait
internet
for
issue.
it to come back.
Yes.
Rashida, we can't hear you.
I'm just calling her and checking what has happened. I'll just.
Just give us a second more while we try to correct what has happened. Stay with us, don't go away. I think a whole lot of important stuff about how do we decide whether it should be home quarantine, it should be a COVID care center, it should be the hospital, and the steps in home quarantine. We've all always heard these kind of important words like home quarantine, COVID care center, but what does it really mean to be home quarantine? If you're in isolation, what are the general steps? I'm waiting for Rashida to start back in so she can really tell us, because there's a very, very specific protocol to be followed when you're in a home quarantine as well. So she'll definitely throw some light on what does it mean and how we are not the ones to really decide what should we do. I think all that I've been hearing in the past few questions or past 30 minutes is talk to the doctor. Saurabh, you're on mute also.
So there was some internet issue at her end, so she's joining back in another 20 seconds.
Okay. And at the end of it, I think maybe a few questions is what I will ask, and then I will have the audience throw in some questions, because I'm sure all of you all have a lot of questions and simple ones, right? Even the mask or no mask seemed like such a simple question, but I think over time we are underestimating the power of a mask. Really, um, we just don't know if somebody is asymptomatic, is a carrier, or whatever, and there's still fear. for example, my sister told me that in her building somebody tested positive, but she also doesn't know what are the steps really. Now, what do I do? Do I stay at home? Do I go to the doctor? Hi, Rashida.
Hey, hi, sorry, Rupal, sorry about that. Internet issues.
No problem. We lost you for a few minutes, so I got some screen time with my audience.
Okay, yeah, no, good.
Okay. So I wanted to talk to you about, you talked about the process, but what are your thoughts really on home quarantine, the COVID care centers, hospitalization? How does one decide? It's not always asymptomatic as home quarantine. So what do you think, and what should we as a patient do if you're tested positive, and what are the three options in front of us, and how do we decide?
Okay, first, when the swab comes positive, get in touch with a doctor or one of the COVID care centers. Asymptomatics, low risk patient. By low risk, I mean people who do not have, diabetes, hypertension, who are young, 30s, 40s, can undergo home quarantine, but it has to be under the guidance of a doctor. People who are symptomatic or asymptomatic but elderly age groups, asymptomatic people with risk factors generally need isolation at the COVID care centers, and the moderate and the severe, that is, where they have symptoms, low oxygen saturation, they are breathless, etc., will need hospitalization. So the bottom line is you have to get in touch with a doctor. Now, as far as the home quarantine goes, so there are certain criteria for this. First, the patient criteria. So what is the patient criteria? The patient needs to be asymptomatic. He needs to be swab positive. He should not have none of the risk factors. Secondly, there should be availability of adequate space at his home. You cannot have somebody who is staying in a 1 BHK do home isolation. It is just not possible. Home quarantine will not be possible for a family of even 6 members, because then a room. Now, for a home quarantine, generally an entire room and a bathroom needs to be provided. An attached bathroom needs to be provided to the patient who will be undergoing home quarantine. A caregiver has to be there in the house. It has to be under the guidance. They have to be in touch with the treating doctor at least once or ideally twice daily. They need to fill up certain forms, so that there's an admission and a discharge process. So and so person has been advised home quarantine. They are admitted for home quarantine, and at the end of 10-day period they are discharged from the home quarantine. All this gets registered. The patient should be able to, the food for the patient needs to be kept outside the door, and he just takes the food inside and consumes it. Of course, while cleaning and all, they wear gloves or they wash it thoroughly with soap and water. That's all right. He should be able to kind of clean the room himself, wash his own clothes and all. So quarantine essentially means you are completely cut off from everything outside. He needs to use a mask. A mask is a must even during home quarantine. So it has to be
Fair enough.
under the guidance of a doctor. You will not be able to do it yourself.
So home
It's not.
quarantine, also the steps that you explain has to go through a doctor. There's a discharge form, there's an admission form, even for home quarantine. And obviously the criteria is that you have your own space and a caregiver and so on and so forth, which is,
Another
good
important,
to know.
Rupal, sorry to interrupt, but one thing I forgot is, so during home quarantine, all the contacts in the house need to be on prophylactic medications, that is hydroxychloroquine. So most of the contacts need to take HCQ prophylaxis, besides undergoing a swab test, of course.
Okay. And this the doctor will also recommend, right?
Yes, the doctor will recommend all this. So the doctor
Okay.
actually goes them and takes them through the entire thing.
Okay. So not all, I mean, there are 50% cases that one test positive and generally a whole lot of all the members test positive. But I know somebody who's been positive, but the members are negative. So is that they continue the test repeatedly, or what should they do? Because they're going to be in the same house. So what do the people who are in the house do?
They have to, if the swab, see now, the first of all, the duration when you do the swab is important. If a patient has tested positive today, do not rush for a swab the same day. Wait for another 3 to 5 days, because that is when the chances of the swab test coming positive are high. Monitor
Okay.
your symptoms. Look for temperature and the oxygen saturation. The pulse oximeter is very easily available in the market. So basically monitor your symptoms. Do a test after 3 to 5 days after the patient has been, after the primary case is positive. And if they come swab negative, they all go under on HCQ prophylaxis. They don't need to be. If somebody from them ends up developing symptoms, fever, breathlessness, or any of the other list of symptoms which I mentioned earlier, then do re-swab the patient, and actually the patient will have to be hospitalized since he's symptomatic. He's moved from asymptomatic to a symptomatic case.
True.
And after
True.
hospitalization, maybe a swab will be repeated, but he's a suspect and you just treat him. Irrespective of what the swab report comes, a swab is not always negative. We see a number of cases who are clinically sure shot cases of COVID illnesses. Their lab reports, their scans are suggestive of COVID. However, the swabs continue to be negative. I've had patients. I remember, okay, again, an example. A patient of mine who was extremely critical. The minute he was hospitalized, he had massive pneumonias. All his reports, everything was suggestive of COVID illness, but his swabs were negative on 4 occasions. One of which was done in one of the PMC, the government centers. One was done at the hospital. One was done with NIV, and one at another lab. 4 swabs done at intervals of 3 days each. All the 4 were negative, and because of this we were unable to secure medications for him, because as per recommendations and laws, till the swab is positive, they you
You
cannot
can't get.
get the medication. But then obviously we wrote special letters. We said, look, the patient's on a ventilator and this is the only option. So, and finally, of course, we did manage to get it. So swabs alone cannot be the guiding. I think clinical assessment and clinical symptoms are very important. Very.
So we have to make sure that we are monitoring our symptoms. There's a thermometer with us, there's an oximeter with us. But that brings me to our next question, Rashida. Is management of COVID-19 and chances of successful recovery really dependent on early hospitalization? You've been talking about timely treatment, but tell us a little more about the importance of, you don't have symptoms today. Should we just hang out and not call the doctor?
No, you call the doctor, Rupal. For sure you call me. Because remember, we are dealing with not an individual, we deal with families when you're looking at COVID illness. And yes, so the same thing, early acceptance of the illness. Yes, I am so positive. Early acceptance of symptoms, yes, important. So then early investigations, early diagnosis, if needed, early hospitalization and early management. The more you delay acceptance, the more you delay diagnosis and management, the more are your chances of going on to a severe case. One thing which we need to remember here, there is difficulty even in the medications being available even today. Of course, it's better, but it's not like I cannot just say I need a medication and I'll get it in a few minutes. There are delays of a few hours to up to 24 hours at times. So if you are picked up, you are at the right place, under the right guidance, medications can be started early for you. If need be, treatment can be escalated. You have admitted yourself when you were a mild case, you are being monitored. We feel no, now you need to move on to the CCU or the ICU, the intensive care units. You can be moved there. Finding of beds is a difficult task.
It is.
Asymptomatic mild cases, okay, so a mild case person calls me up today, it takes me another 3 days sometimes to find a place for the person. So it's actually like booking places. I'll call up the hospitals and say, okay, please, this place so and so person needs a space, kindly make some place available. So as soon as we have a discharge, this patient is brought in, and now we have already lost 2 or 3 days at home. Once he comes home, hopefully, if he's still not become really critical, at least the management, the treatment is started on time. So early admission to the hospital is a must, from management point of view, then secondly from the recovery point of view, as well as from finding a place point of view. Three important reasons for it.
So what about recovery? You've been, handling patients every day in and out. Anything specific or you want to highlight about the recovery? Assume that, okay, fine, there's early hospitalization. What are your thoughts on the recovery and what has been your experience really in terms of recoveries?
Okay, so now initially when we started dealing with these patients, our only intention was let them survive and go home. So we were all looking at the survival of these patients and quickly moving them out. But now patients are beginning to come back for follow-ups, and we have realized people who were admitted on time land up having, uh, basically they come back quite clear. They do not have any problems on their follow-ups. People who were came in late in their onset. By the time they were actually, severe cases, they come back with two or three issues. The lungs and hearts of these patients have been found to be infected. They've, although the virus is cleared, but it leaves scars on the lungs at the time of the recovery, and a lot of people come back with cough and breathlessness while walking or on exertion in their follow-ups. Hearts have been found to be affected. There's some amount of heart failure which is beginning to set in. I've even seen in some papers mention about cognitive decline in a group of patients. I've not come across anybody with cognitive decline, but yes, lungs and heart are very commonly affected. Another important thing is we notice people who with COVID illness, somehow even people who are non-diabetic, their sugars are like skyrocketing for 300 plus. You have sugars of 400 and 500. They come to the hospital with sugar. They're all the while on insulin drips. It's very difficult to manage the sugars. So I don't know if, in follow-ups we'll slowly recognize over, of course, a few more months if diabetes is a common complication or a problem which is commonly seen in this group of patients.
It's
So
really scary. I mean, that it's not over when it's really over there. You have to still be very vigilant and keep a
yeah.
tab on what you're feeling, your sugar, your heart, or whatever, which
Another
makes me just, yeah.
one second, just one thing. So UK in the United Kingdom, they've come up with this. It's still not started off, but they're planning to follow up nearly 10,000 patients for 20-25 years. So they have this concept of COVID survivor clinics, which they are thinking of, and they might in this thing later on. Probably something similar needs to come, may start off in India also in a few months, but because it's going to be the need of the hour, it's going to be the need of the times. With so many people surviving, going home, when they come back, you need people who have seen them through the illness and being able to manage them.
So I surely hope we in India also start with
I
this
hope
whole
so.
COVID survivor groups
Yeah,
and
it's already
centers
needed.
and things like that.
Yeah,
Okay,
COVID.
so hopefully we'll start that. But how long do you think this whole thing is going to go on? I think all of us keep wondering and all of us keep hoping ki Atta Sampel. Now the peak is over. Now there's a flattening curve. When will all this be done?
I do not have an answer to this, but people think and feel that end of 2020 will be the end of COVID. No, it's not going to be like that. It is going to be there around for a number of years. It's not going to get wiped away so soon. But yes, things will get better because there'll be more, and there are so many medication which are going trials. There are various other medicines which have been discovered which may help people. So slowly, you will have better ways of managing, treating these patients, lower chances of people from mild cases going on to becoming moderate and severe cases. Vaccine, again, there's a long time before it comes out, but herd immunity, probably some of us would acquire herd immunity, so it will come down, but it is here to stay for a long time.
So
End of it
is
is
that
not.
your most scary bit about the pandemic? Is what about the pandemic scares you and what really gives you hope? Both ways. I want you to give us a view.
Okay. I think what scares me the most is the stigma. Uh, COVID is like a stigma. It changed the globe, it changed millions of people across the world. There was a point in time, or I think even today, people are scared of people. You see somebody just next to you, and your first tendency is to take 4 steps back. People in societies have undergone bad this thing because neighbors refuse to accept them. There have been families who have been completely isolated. They had nobody to even provide them with meals and all. We even hear stories of doctors being, troubled in their societies. So it's a whole lot of stigma with the disease. Now, from the patient's point of view, the fear amongst the patient and the relatives is not just the illness, it is the fear post death. Because if you are COVID positive and you die, the bodies are not handed over to the relatives. They are generally taken up by the officials who come from the PMC, and they are incinerated, or whatever that is who they dispose it of. The bodies are covered in cloth, and then there is a huge plastic bag in which they carry the bodies away. So there are times people don't even get to see the face, and I think that worries a lot of patients and relatives. I remember a relative telling me, Madam, I understand my mother is very critical. I completely understand she may not make it, but can you at least make her COVID negative over the next week or 10 days because I want her body? And I was like,
Wow.
it's very sad. But this lady survived. She's going home in next 2 days. So,
Okay,
yeah,
that's
she makes me very happy.
a lot of recovery stories. That gives me hope for sure.
Lot of recovery stories. But you have to
So there's
work
that
hard.
what gives you hope that
Yes.
you are able to recover, and a lot of the doctors are able to get the
Yes.
patients recovered and back home.
Yeah, so hope comes. Another thing, the mortality rates are not very high as what people right now. COVID is equivalent to death. It's not so. 80% of the patients are asymptomatic. Mortality rates are they're very distinct data, but most of the other parts of the world reported less than 1% mortality, whereas in India it is said to be between 1 and 2%. But remember, we are not sure of our denominator. We do not know how many of us actually affected. The testing still lags back. So the mortality rates are lower and people do recover and go home. COVID is not equivalent to death. People need to let go of the fear and approach the doctors and the healthcare earlier in the onset of illness, and basically be under the right guidance.
Yeah, absolutely. Right guidance and get over this fear and stigma, which again is an important thing. Yes, we should get over the stigma, go to the hospital on time or call your doctor on time. But do you think our medical centers will be able to manage treating the patients considering the rate at which, the cases are increasing?
It will definitely get better, Rupal, because there are a lot of makeshift arrangements being done. The entire Balewadi Stadium has been converted in Pune. Sanas Ground in Pune I've heard of a facility coming up, a 800 bedded facility with 300 oxygen beds coming up. So things will get better. The staff will get more trained, the doctors will be more experienced, but it's never going to be 100% for sure. The healthcare will always lag back behind, although it will get better. It is already better. It is much better than what it was 3, 4, 5 months back. Much better. We have a lot of people who are coming out of ICUs and are actually going home. A lot of people who are recovering.
That's very true. I think I've asked you enough. I know that the audience is also waiting. Thank you so much. I think we take a lot of important messages back, but the key thing that struck me is about the timely treatment and be very sensitive to what the symptoms may be. Get tested, go to the doctor in a timely manner. Don't wait and watch. Just, your best shot of recovery, which is 99% is possible if we call the doctor on time. So I want to get Saurabh back into the conversation, and I think he'll take the audience. And
All
I'll
right.
just wait. Rashida, thanks.
Yeah.
Yeah,
Thank you.
So,
Thank
thanks,
you so
Saurabh.
much, Rupal, for all the questions. It was a really interesting information to your. So we're going to take a few audience questions now.
yeah.
Yeah. I have a question from Geeta Prakash. A next of kin of my parents' maid has been diagnosed with COVID yesterday. Do I need to test my parents? Their ages are 86 and 77, even though they have not shown any symptoms yet.
No, but have they, who has been tested positive? Sorry,
So a relative of their maid.
a relative of their maid has tested positive. Yes, her parents should get tested. Has the maid come? If the maid has come in contact with the relative and has been traveling home, yes, her parents should get tested because they're elderly, and it is important that we diagnose them on time. So, yes. Saurav? Yeah.
Okay, all right. I hope, Ms. Geeta, that answers your question, and it is important that you get your parents tested as soon as possible. We have
Including
another,
including the maid, Saurav. The
yeah,
maid,
it would be, of course, of course. Next question is from Srirang. You mentioned if you test positive, you should go to a doctor or COVID care center. Does this mean people are potentially going under the radar by not contacting the authorities despite of testing positive? So are people not contacting authorities after getting after testing positive? Is it happening?
yes, a lot of them are not contacting authorities because it is not uncommon for us to see people suddenly coming to us and saying we are not feeling well. Okay, when has the test been done? The test has been done 8 days back. So people essentially would have symptoms, some small symptoms for 3 days. They would do a test positive. They would wait for another 3 to 5 days before they come and meet a doctor once the symptoms worsen.
Okay.
Unless,
Right.
of course, through contact testing, the authorities have been trying to do their best, but it's not possible, to do contact tracing all the time and actually identify. Yeah, although even the laboratories have been reporting to the government, so all the reports from the labs are sent to the government, and then the government kind of tries to contact trace these people, but it's not going to be 100% successful till the patients take an initiative themselves and step forward and meet, or basically go under the guidance of some authorities, doctors
Very
or.
true. And I guess this conversation, what we have had today, will open people's eyes and will give them a better judgment of contacting doctors, because, as you've mentioned earlier, early hospitalization and early diagnosis are two of the very important things in successful recovery. So I guess people
Yes,
will start
very
following this if
important.
they are not.
The single most important thing for people to
Very
recover
true.
it.
True. So the next question we have is, how long senior citizens above 65 are supposed to remain at home? If at all anyone comes out, what precautions are to be taken there and back? So you've pretty much explained this earlier. If you just want to add something to it, you
No,
can.
so 60 means you are trying to, if somebody who was positive, and no, just I
No,
mean,
they just, like, as a precautionary measure, people over the age of 65 have been asked to stay at home. So how long do they have to stay at home, and if they need to come out, what precaution they should take?
see, you definitely cannot stay home all the time. So for your essentials, it is all right to come out, but again, wear a mask, soap and water or sanitizers, maintain distancing, and just go out for whatever work it is needed and come back in soon. Do not try to be in groups or in crowds. Small walks and all are perfectly all right, provided there is not a huge amount of crowd. Like certain localities or early morning where people have yet not stepped out, maybe doing short walks in areas which are not in the quarantine, they are not the red zone areas, is absolutely all right. It's not
Right.
possible to say, because there's a whole lot of other problems. There's a lot of depression, there's a whole lot of emotional imbalance, and a lot of other problems which are creeping in.
Very true. Very true. Next question is, by this stage of community spread, is it recommended that if we are interacting with senior citizens all the time, should we take an antivirus test even without symptoms?
Even without symptoms. Uh, how often can we do the antivirus test? There are
True.
children and we have our parents staying in another part of the city. It is not possible for us to test ourselves each time before we go and meet them. If you have come in contact with somebody who is positive in your societies, at your workplace, do test yourselves. Otherwise, you can meet your parents, but as when not as often as you were doing it once upon a time. Maintain your distancing, and again the mask, etc., would be compulsory.
Right.
It's not
Right.
possible to test every time. Not presently, at least. It's not possible presently. I don't know if
True.
sometime in the few, sometimes some you might have tests which are available at very low cost. Something like your pregnancy test, urine pregnancy, whereby it's just a kit. So if you have certain tests where you spit or some, and it says a positive or negative, which is available at very, very low prices, like I don't know, 40, 50 rupees, it may be possible.
Right.
But presently, it is not possible. There's a lot of load on the existing labs as well, laboratory.
True. True. Understood. Okay. The next question we have is not related to COVID, but does sleep apnea patients have low oxygen saturation?
Yes, they have low oxygen and they have high carbon dioxide in their body. That's called as hypercapnia. And that causes a whole lot of sleep problems. They have what is known as this apneic spell kind of things in the middle of the night, and where there's a lot of adrenaline drive in the body, leading to hypertension, heart problems, diabetes, very commonly seen in people who have this issue. And these
Right.
people generally are obese and they are at high risk of having problems, even if they acquire the COVID virus.
Right. Right. True. I hope that answers your question, Miriam. Okay, next question we have, I guess this is from a doctor who runs a hospital. How do you think we can build confidence in patient seeking super specialty treatment, since most of the hospitals have become COVID centers?
I think counseling. So now, if can you repeat the question, Saurabh?
Yeah,
I
sure,
don't think
sure.
it.
So, how do you think we can build confidence in patients seeking super specialty treatment, since most of the hospitals have become COVID centers?
So we'll have to counsel them. We'll have to speak to them. People who are seeking super specialty care, most hospitals are divided into COVID and non-COVID areas. The
Right,
entries and exits to these areas are completely different. So that would be one answer. Second, this thing is telemedicine. I think telemedicine would probably help. A lot of problems and issues can be related to health. Maybe you may be able to sort out online itself. So these are the two things which come to my mind.
right, right.
But
Understood.
counseling them is what is important.
Right, true. Then, so there's a question about blood clots due to COVID. Is something new that I have heard. So, can you talk more about it?
All right. So now the COVID virus, you have initially there's a phase of where the virus multiplies and it kind of spreads through the body. It stimulates your immunity. So now generally your immunity should favor you, but here the immunity goes against you. It leads to what is known as the cytokine storm. And that is a point where you have extensive inflammation all throughout the body. The inflammation basically leads to activation of whole lot of clotting factors, this platelet aggregation, and that leads to the formation of these blood clots. And there's something known as the von Willebrand factor, which contributes a lot in this. So then these clots, two important organs which get affected, of course, are your heart and the brain. So strokes and heart attacks. Therefore, a lot of our patients, when they are in the moderate category illness, if we start them all on blood thinners, we start them on what we call as heparin, a low molecular weight. It's an anticoagulant as well as an antiplatelet agent, that is ecosprin. Mild cases we do not need to, but mild cases in high risk category, elderly, diabetics, obese, we always add blood thinners to them. Moderate and severe category would always be on this group of this thing. So the treatment actually is, three things. One is try and kill the virus at the earliest. That is where your antivirus play a role. Second is once the virus sets off that entire immunity, hyper immunity kind of thing in your body, you need to suppress the immunity. That is the role of your steroids. Third is it causes the formation of these blood clots and therefore the blood thinners. So most of the treatment is centered around these three things. And then the fourth is, your supportive management, like high doses of vitamin C, zinc, N-acetylcysteine. There are a lot of vitamin D3 and a whole lot of things which keep getting added.
Right, right. I hope Tejas that answers your question, and that's all the audience questions we have for us. Thank you so much, Dr. Rajra. It was a very insightful and informative last 1 hour that we have spent talking to you. You've cleared a lot of doubts that we and the audience had in their minds about COVID centers, and thank you so much for giving out all that information in such simple words that all of us could understand what is happening and what role doctors and COVID centers are playing in the management of COVID-19. Thank you so much once again for giving us time and joining us today.
Thank you, Saurabh. It was wonderful, actually. It was good. Thank you. Bye.
Thank you. Thank you so much. And to all our viewers, thank you so much for joining us. Do follow Sancheti Hospital and HealYos. We're going to keep coming every week with another prominent personalities on the front lines of COVID-19 management, and we'll keep getting your questions, your doubt answered from the personality from people who are at the front lines of COVID-19 management. Thank you so much for joining us today.